Okay, hi y'all. Gideon Mosse, Policy Coordinator here. I have some opening words really quickly. Good evening, everyone. Thank you so much for joining the NASW-New York CARES Community Engagement Initiative for the third event of the School Social Work Series, Policy Developments Impacting School Social Work. My name is Gideon Mosse, and thank you so much for coming. I am Policy Coordinator here at NASW. Registration for the remaining two events of the NASW New York CARES School Social Work Series is still open, including a CE opportunity. If you're looking for more CE workshops, we also offer a robust CE schedule. There's absolutely more on the horizon for the chapter. We hope you opted to add your email address to our email list so you can start receiving communications from the chapter, including our weekly email digest sent every Wednesday that provides the most current information from NASW New York. Post-event, you'll receive an email that will share all of this information about what's upcoming at the chapter, as well as any resources or information provided by tonight's guests. Please remember that by registering for any NASW New York events, you agree to abide by the NASW New York anti-harassment policy, which I will post in the chat shortly. Before we begin tonight's event, we want to take a moment to acknowledge that NASW New York recently experienced a Zoom bombing incident during our free virtual CARES programming. We are actively communicating with our national office to implement stronger preventative and responsive protocols, as these types of disruptions have unfortunately been on the rise across virtual platforms across the nation. While we are taking every precaution, we want to prepare you that should an incident occur today, it may involve hateful or emotionally distressing content. Please know that we are ready to immediately handle an incident should it occur again. Our mission remains to provide free and accessible NASW New York CARES community engagement programming to support New York social workers with content that matters to them. However, if these disruptions continue to escalate, the chapter may need to reconsider the structure of these offerings, including the possibility of instituting attendance fees to better protect the integrity of these events. We appreciate your understanding and ongoing support. Once again, thank you all for joining us this evening. If you have any questions about this event or any community engagement events at the NASW New York chapter, I will drop my email in the chat shortly as well. Without further ado, let me introduce to you our presenter for the evening, and I will very briefly make sure that she's here. Samra Brouk, Senator Samra Brouk, hello. So luckily enough today, we were able to get State Senator Samra Brouk to present on her bill. I just want to make sure that everything looks good. Roma Khan, is everything okay here? Perfect. I'll give you guys the floor now.
Beautiful. Thank you so much. It's so great to be here with all of you. I was just listening to the introduction, and I'm so sorry that we're still in a Zoom bombing world. I thought that was kind of over with in 2020, but I am really happy to be here with all of you again. If we don't know each other, I'm Senator Samra Brouk. I represent the 55th Senate District, so I'm up here in what was snowy Rochester, New York, for anyone who's not in Western New York right now. But luckily, that's subsided because we are not ready for that yet. But most importantly, for today, I am also the chair of the Mental Health Committee. And I'm so grateful to be here because, I do want to say thank you to all of our social workers, but specifically NASW, because y'all have been such a great partner to me coming into this work. So for those who don't know, I first ran in 2020. Which means that I started my term in 2021, which was certainly a complicated time to start your tenure in the Senate in the middle of a global pandemic. And one of the things that I had heard so much on the campaign trail actually was about mental health and about the increased need of it, whether it's for youth specifically, the workforce itself being burnt out and really unable to sustain, the lack of state funding. And so because of all those things, I thought it was really important that we establish a mental health committee to stand alone on its own merit, not combined with anything else, which it had been previously. And so we had a lot of work to do because we had to establish this standalone committee. I was lucky enough to be able to chair it, and we would not be where we are today had it not been for all of the partnership from NASW and the partnership from social workers all across this state. And honestly, even the country, we've got people from other states reach out to us around how to do some of the things that we've done in New York, believe it or not. So I just wanted to give those accolades and gratitude for the partnership. And, I know today specifically, I know we want to talk about one of my bills that particularly is going to affect young people around having more social workers, school counselors, and school psychologists actually in our school settings. And so I wanted to actually start and share just anecdotal things that I've heard. Obviously, you all in your day-to-day life are experiencing what it feels like to have a shortage of social workers, right, in this field. But I think it's also important to note that, every time I go visit a school, every time I speak with educators, with students, with parents, what I hear is probably similar to what you are experiencing every day. And that is a few things. One, that spoiler alert, we've never had the workforce we've needed in our schools. There's a number of reasons for that. It's, issues with licensing. It's issues with having competitive pay and allowing people to enter these fields. It's issues with testing, right? And how it really has become this unfortunately biased tool that has precluded certain, groups of people from being as active in this field as we'd like them to be. But what you also hear is that since COVID, that the needs for these young people have shifted. And what I'm hearing is that on one hand, the needs have become more complex. These are young people who have gone through so much, right? I mean, the COVID was kind of the tip of the iceberg. Think about what's happened since that pandemic, an attempted coup on our government just months later. I mean, to think of all of these things that have happened in the last few years, and those of us, 80s and 90s kids, we weren't going through quite so much in such a short amount of time, frankly. Although, every generation has their major pivotal moments that form, their worldviews and how they, interact with the world. But, no one would argue that there hasn't been a lot that these young people have dealt with. So what I'm hearing is that there's an increase in complexity. But what that often means is even the ratios that maybe if we had achieved certain ratios in the past, we actually need more professionals per student ratio now because these challenges are more complex. The other thing I'm hearing is that just simply more young people need extra help. And I think that we've gotten to a point here where I'm hoping we've all come to the realization that this type of socio-emotional support, this type of support that our counselors and our social workers are providing at a school level is no longer like an elective, right? It's no longer a nice to have, but in fact, it is something that is absolutely necessary for our young people to be able to learn. Coming out of COVID, one of the things I shared a lot was, listen, you can hire, and of course, we need our reading specialists, we need our math tutors, we need to do that. But the truth is, if a student does not come prepared to learn, if a student does not feel safe, secure, comfortable, confident, they are unable to learn. And I liken it to as adults. Do we not all have bad days? We all have bad days, but we are mostly, hopefully, well-balanced, stable adults. Now imagine a growing brain, right, that has just gone through a really globally traumatic event through the pandemic and these other things. We cannot expect our young people to show up with the same ability to regulate that we have as adults, in our 30s, 40s, 50s, 60s, are able to do. And so that's really what, this legislation and other legislation that I've introduced alongside many of our social worker and mental health providers here in New York is around better addressing the challenges that we're seeing and being real with each other around what it's going to take to actually help. And so I have so many bills I'd love to talk to you about, but we're going to focus on S376, which I see someone just put in. Thank you, Gideon, so everyone can read up. So this is actually a bill that will help us establish kind of where we are right now in terms of what are we seeing statewide around this ratio of counselors to students. And I'll be honest, for me, I'm a millennial, so I'm impatient. So I would just want to jump the gun and be like, I know what they need. We all know what they need. Just give them more counselors, give them more social workers, give our schools more money, right? But one thing I've learned about state government is that you really have to kind of put the breadcrumbs down for them to actually see what probably anyone on this call sees every day, right? And so that's the goal here, is to really lay out in black and white terms where we stand as a state, and then to build on that by requiring better, smaller ratios of our counselors to students. And then the other big piece is that one thing we hear from a lot of our schools, a lot of our public schools, is, lack of funding, right? So we know that before, I was in office, before 2021, here in Rochester, for example, our city was owed almost 100. Actually, it was a ridiculous amount of money. Our district was owed literally almost $100 billion over the course of many years of school funding from the state through foundation aid. And so many of our districts have been operating at a deficit. Now, in 2021, we finally changed that. But what we know is that having 1 year as you move closer and closer to fully funding this equitable aid formula, you're not going to resolve all the ills and all the challenges and the gaps that have existed for decades. And that's what it was. And so within that, we do need to make sure that we are allotting specific dollars to go towards these mental health supports for our schools. And I think that when I talk to a lot of school districts, that's usually the first thing that they're worried about, right? I encourage them to use, in our first, budget hearings back in 21, I encourage them to use your ARPA funds, your CARES money. Listen, this is an acute problem. We need help now. And that child getting the extra help for even 2 years, even if we have to fight for the funding for the third year, that could be tremendously helpful. We could set that young person up for success. And so obviously we are past the days of the federal government actually helping our students in our schools. We now actively have a federal government dismantling our Department of Education. So it's a very different world we live in. But what the good news is it is not a different world in New York State. We continue to have strong leadership in New York State that understands the importance of this work in our education system. You certainly have a mental health chair in the Senate that understands it, myself, and of course, my new colleague, Assembly Member Joanne Simon, who is now the chair of mental health in the Assembly. And we really do agree that these are things that we need to continue to prioritize. So we would love to have, as many of you who want to show support. Obviously, it's always the most powerful to hear from those who are impacted every day by this legislation, and also to share with, me, but also your own legislators, wherever you are, what it would mean to have a working ratio that actually is meant to help students and our social workers and counselors, right? What would it mean to have a workload that is manageable? What would that mean for how you can show up for the young people that you work with? And I think that it's so important that we both identify these problems, but that you also paint the picture of what it could look like if we actually addressed this head on. And I'll just kind of end here and give some space for questions, but I want to leave you with this. You know, I don't know how many of you are New York City based. You can probably just do like a thumbs up or a hand on your reaction. Okay, Gideon is. Oh yeah, okay. So there's a good. Oh, look at all those. Oh, that's a fun thing. I've never done that, but I love it. Okay, Mindy, Emma. Oh, great, great, great. Andrina Nelson. Cool, cool. So I got that. I love the NYC Pride. But the reason I asked that is because look what just happened in your city last Tuesday. In a candidate instilled hope in people, right? Didn't just talk about what was wrong, but talked about what could be right and what you could do to improve. And I just want you, you know, as mental health providers, right? You're probably thinking this too, right? It's all about mindfulness and it's about, you know, reframing the realities and all of these things. But I think it's very telling that that was resonant with people. And so I want to challenge all of us to obviously identify the problems, right? That is our job. But to also talk about what we can build. And so when you are doing your advocacy, let's keep that in mind of what we are trying to build. And what we are trying to build is a system in which when a young person knows they need help, they know where to go. And they have someone that opens that door or picks up that call when they're seeking it. We're building a world, right, where a friend who sees another friend struggling has that trusted adult, has someone who is a licensed professional who can actually help them, because we also know the wrong person can actually be harmful. And what we're trying to build is those challenges to be resolved right then and there, right? Right as this young person is dealing with these challenges to set them up for success, for graduation, and for a full life that doesn't have them in the constant revolving door of a mental health crisis as an adult. And so that is our goal. I know that is what you all work for and work towards every day in your own work. And I want to say thank you for that work. I know it is not easy work. I know that it is often thankless work. And you're often, you know, speaking with people on some of their worst days. No one comes to you when they're having their best day ever, right? And so that can be incredibly taxing. So I'm very grateful for that work, and I'm very, very grateful for the partnership. And listen, you know, this is a bill that can move this year, right? It will take time to do the initial, you know, studying of these ratios, which means that it won't be an immediate cost to the state, which means that even in a very difficult budget year when the federal government is taking away Medicaid dollars and education dollars, it is still something we can move forward with. And so thinking creatively about how we continue to move forward in this space, even in tremendously difficult budget years, will be really important to us to lay that groundwork for when for when hopefully things shift at the federal level eventually, and we get some more of that funding. So I will leave that there and open it up to questions. I don't know if Gideon's giving them to me or if I should search in the chat myself.
Yeah, thank you so much, first off, Senator Brouk. That was fantastic. So if you have any questions, feel free to either put them in the chat and I can read them out, or raise your hand and we'd love to call on you. We love to hear obviously from y'all, so please feel free to speak up. Okay, Petunia. Just reading through this really quickly. Would you like to elaborate on this actually, Petunia, if you'd wanted to?
Hi, thank you. So I just had a couple of key points, feedback. I know that there's a quote unquote shortage in the profession. I do think that there are many reasons as to why, barriers. Number one, I think that the profession, this is my personal and professional experience being in the practice. I feel that the position is a ghost position. It can be preventative. but it can be the last resort. So that's why I state red blood files, because that's ultimately what it is when you come down to be a social worker. I think that the profession is very unique and there needs to be a passion for it. It's the reason why there's a lack of funding that comes along with it. So I think there's a reason as to why there aren't individuals in the profession, because realistically, you're not able to survive. So if there's a question as to why there isn't anyone in the field, it needs to be reviewed as to what's the give back. I think that people will state social workers are wonderful or great, but I will state for myself, my question is, what is it that you want from us exactly? And then in regards to support, it's important for people to be able to have self-management, because there's not enough individuals to help each person. So resources, training, practice, so that people can have an opportunity to have self-management, because it's not realistic to have a social worker that has a caseload of 50 plus and then think that they're going to be able to manage that. So the schedule, the burnout comes along. And then also for those that are not within our practice, I think there's a huge gap as to what it is that we do. I find that there are individuals that are in positions that say that they're going to be doing something and then turn around and say that social workers have to deal with it. But I don't see what is it that you guys are doing for us.
Are Just so I can understand also, Petunia, are you asking what as a whole you all social work as a career, what you should be pushing forward to? I'm so sorry, excuse me, I'm just a little confused on the question. You're just asking what should social work as a career and as a workforce should be doing so that you don't have this burnout, so that you don't have et cetera, or is it something else? Excuse me if I'm misunderstanding.
No, thank you for clarifying. I can say that from my experience for myself and those that I've had opportunities to work with, I think that we have a basic foundation of what it is that we're supposed to be doing. It's just, again, other professions coming together to actually support the cause. So as I come onto these platforms to get a better understanding as to what's going on with the system, I hear a lot of things that, again, just don't make sense. And more so, this is what we're doing and this is what social workers have to deal with. But in order for us to do our part, others need to follow through as well too. So again, there's that gap of what is truly expected of us and what we actually do.
Thank you, Petunia. I mean, I'll just say from my perspective, kind of selfishly, anytime I can hear direct feedback like that of what y'all are going through, how you frame it, even I would have never framed it the way you did or known that that's the kind of the way that you're thinking about it. From my perspective, the one thing that stuck out to me from a legislative stance is this piece that you talk about of how other professions exist within this space and how they interact with the work that social workers are doing. I'm also not surprised to hear, there may be a lack of understanding, perhaps a lack of respect or value put on what social workers in particular are doing in the larger scope of, mental health practice. And so that is something that we encounter a lot, at least in my role, dealing with every mental health licensure and profession, right? Like I cover everything under mental health. Obviously, social workers are a huge a percentage of the mental health providers in our state, but definitely hear you on kind of how the mental health ecosystem supports one another and how you're making sure, because one young person, one person in general may interact with any number of professionals, right? and how do you make sure that they're actually working together and not just working together for the individuals they're serving, but working together as practitioners to ensure that you're all clear on your roles, that you're valued in your roles, that you're paid that value, and that you see this as a role you want to aspire to. Because I also heard that from you, that like recruitment, right? Like why join this field, right? What is there other than, like you said, the passion? But as someone who used to work in nonprofits, passion does not pay the bills. You still need to have actual career trajectories. And I know you mentioned the COLA in some of your messaging. So I don't know how many of you are actually, private providers who would be impacted by that. But I know that had been a major, major pain point of getting these cost of living adjustments. I'm proud that we've been able to provide them since 2021. Disappointed that it's never enough, frankly, and it's never what we ask for. But my hope is at the very least it's a signal that I certainly, for one, don't intend on going backwards, even in the toughest of budget years, that this continues to be a priority.
Awesome. Galen, feel free to unmute.
Hi, it's Jay. No
Sorry,
problem.
my apologies.
No problem. My question was on funding, and how the bill affects schools that are funded, based on student enrollment. So I know the biggest, funding source for New York City schools is by FSF, fair student funding. So I was wondering how that might affect the bill implementation.
Absolutely. You said Jalen, right?
Jaylene.
Oh, Gayleen. Oh, I didn't hear it at all.
Jaylene.
Gayleen. It's funny. I heard the whole question, but for some reason I couldn't hear how to say your name correctly.
No problem.
It's important to get it right as someone with a name that most people get wrong. So I appreciate the question, and hello, downstate New York City. So what you bring up around funding, so one of the major challenges we've had is that anytime as legislators we want to introduce anything around adding services, adding, requirements, a lot of times school districts are like, that's unfunded. Like that's a mandate that you're not paying us for. Like that's going to be very difficult. We're going to have to cut other programs. So the key with this bill is that it is not asking school districts to reallocate existing funding. Instead, what it's asking is once we identify what the ratios are currently and what they need to be, like the plan to actually achieve more nationally accepted ratios, that we then allocate that money in a future budget. And so that funding can come from any number of sources. It's the same as any program that we've, implemented through any other sector, right? Whether it's mental health, schools, maternal health. I do a lot with maternal health that we've created programming for. So it would be fighting for an additional budget line when it comes to our education budget. The two biggest budget lines we have are health and education in New York State. So eventually it would call for increasing funding to those schools. And it would be particularly for this exact reason.
Thank you.
Okay, awesome. Really quickly from the chat, I'm just going to read this out as I just saw it pop up. I'm concerned about the impact of social media and screen time on the mental health of students and really all children, teenagers, and young adults. The research is clear on this. That it increases levels of anxiety. This is a pervasive influence that may be too deeply rooted and ubiquitous in our society to be addressed by the bill. What are your thoughts on this?
And I'm sorry, this will be my last one because I've got to go at 6:30. But my views are, I completely agree. I mean, you're the expert, so why would I disagree with you? You obviously have seen this in your everyday. I know that I don't want my 3.5-year-old to have a phone for as long as she lives, I swear. I mean, maybe at 25, if I can get to 25 and give it to her. But I think less about this bill and more about actually what we just passed in this past budget this year was was the cell phone usage, right? So I visited a lot of schools. I've talked to a lot of students and parents about how that transition is going. Now, yes, it is district by district, so schools do have some local power on how they are holding on to phones during the school day. But I've heard, mixed reviews from individuals around, no longer being able to use their cell phones during the day. As someone who is a parent, and quite frankly, even though my daughter's 3, but as someone who sits with a lot of people in the Senate conference, I will share with you it was the parents that spoke the loudest when it came to passing that legislation around banning the prevalent use of cell phones in schools. And it's really hard to argue, right, with a parent of teens who sees every day the impact that having a constant screen and social media throughout the day at school and what that's doing to their kids. And so I believe we came to, excuse me, I believe we came to a good compromise, a decent compromise between the many different stakeholders on how this needed to be rolled out. It's not perfect by any means. I think we're going to learn a lot and see a lot, collect a lot of data in the next 2 school years. But we are about 2 months in, right? About 2 months in to the school year for most folks. And I think we've already seen, an increase in concentration and not having those screens in front of them. So I absolutely agree with you. And I think that I think New York made the right choice. And I voted yes for it. I think New York made the right choice in limiting the screen time for students in schools, and we'll look forward to what we do next and how we learn how that's affecting them and how we can pivot to make sure that we continue to support the mental health of these growing brains. Thank you.
Thank you so much, Senator Brouk. And with that, that is the first section of this Zoom. And feel free to leave. Thank you so much, Senator Brouk. And we're super happy also to have S376 to be one of our CAD priorities this year. So thank you, and we're so excited to get that passed, honestly. But yeah, have a great night. Okay, so with that, I will start my own presentation that just discusses CAD a bit and what we're doing at CAD. I'm gonna need to share my screen. Okay. Uh, okay, perfect. So the CAD priority S376. So we're gonna get into Senator Brouk's bill briefly and continue with just some of the points about school social work that we are really focusing on at CAD as it is one of our priorities. So just to read it out plain and simple, the student need in New York schools is incredibly high. Schools are the most reliable access point of mental health support for many students and children, frankly, and school social workers help that incredibly. There's proven data to show it, which will be in this presentation. Unmet needs show up in attendance, grades, crisis response, and school climate. And gaps are the largest where needs are highest. Equity demands support from social workers. So as 2 factoids here, in 2022 to 23, roughly 1 in 3 New York students were chronically absent. Among high schoolers, it was around 34%, which is a ridiculous number. And in 2023, CDC found that 39.7% of U.S. students reported persistent sadness slash hopelessness. Among female students, it was 52.6%. Obviously, these are problems that you can approach with social workers in schools and psychiatrists in schools, and that's why it is so key for us to keep social workers in these schools. So briefly, just a little graph here. Youth mental health trend line is continuously going downward, and it's incredibly sad, frankly, to see. We see specifically in schools that children and high schoolers are getting like more sad and depressed by the year by year. That being said, school social workers and psychiatrists can make a huge difference in this problem that it continues to pop up. So, high levels of this is all in the graph here for you all. Um, so what do school social workers uniquely do? They find the problems early and calm the crises in the moment, which is key to have in these schools. A lot of the time, parents can't be there for the mental health of these students, so it's key to have school social workers there. Um, Connect general ed, special ed, and outside providers with cultural respect. So my point to all this is school social workers are continuously having a positive effect on 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 schools and on students. And it's clear here with some of the facts from UP John research. When schools add mental health staff like social workers, more students get help and self-harm goes down. Care use rises up by 8% and suicide attempts fall by about 15%, which is frankly like key and highly important to keeping students to keeping this trend line of depression in students from going down more or going up more, excuse me. And then in NYC community schools, uh, which are schools with social workers, behavior problems dropped about zero point 0.1 fewer discipline incidents per student each year. In a 500 student school, that's roughly 50 fewer incidents. These numbers are not to be looked over. Obviously, school social work has a direct effect on students. So just as another graph here. So this graph on the right is a county level map of percentage of students in schools reporting police and no counselors. I found this a bit shocking. Those places in blue, just to explain the graph a bit, the places in blue are places where students report it 0 to 1. It is the 0 to 1% range where students are reporting having seen cops and no social workers. So if you're seeing blue, it normally means that there are cops or security in schools and no social workers when social workers have an obvious effect. You can see in the top right there, I couldn't find a graph with just New York, but New York is still frankly incredibly in that dark blue area, which is obviously having a negative effect on our students. So many schools don't have mental health staff on campus, or the student to staff ratios are so high that true prevention isn't possible. Districts often increase security spending, though, without growing clinical teams at the same time, which is impressive to see given that a lot of these schools can even have teams of almost 4 or 5 security details or cops versus not having a single social worker. That mix leads to slower access to help, missed chances to intervene early, and more crises in classrooms. Nationwide, millions of students attend school with police, but no social workers. This is a huge problem, and we really hope to get the social work numbers up and getting close to what there is with security in schools. So the target we're moving toward, this is probably most important when it comes to everything for Capital Action Day specifically. So the SSWA, AA, which is the School Social Work Association of America, has made a national benchmark of 1 to 250 students, one social worker to 250 students. Sadly, no state meets that benchmark yet. In New York City specifically, it is 473 students to one social worker. The goal is to really cut that down. That is in New York City, though. That is not in the broader New York area. And at the bottom here, a compliance snapshot, 95% of New York districts did not meet the 1 to 250 benchmark. 19 districts reported zero mental health staff. This is incredibly sad, and this is part of what S376 is hopefully going to approach. Okay, so S376 makes clear preventative processes and clear tracking of school social workers so that we understand where school social workers are needed. So the issue is NYC is able to show that the average is 473 to 1, but New York as a whole, we can't even track a lot of the time school social workers. What S376 tries to do is it allows us to track social workers and get the correct funding so that we understand what areas of New York State in total are in the most need out of everywhere else, I guess is how I'd describe it. And the reason it's 1 to 250 is because this has been argued by the SSWAA as manageable caseloads for social workers while still giving the correct amount of attention to students. So S376 from Brouk, what the bill does. So publish the numbers every year. NYSED must report by district and school how many social workers, counselors, and psychologists there are, and student to staff ratios. This is probably the most highly important part of the bill, in my opinion. What the goal is we need to find these pockets where there are no school social workers. The fact that we have a career that job opportunities are becoming harder and harder to get, but a career that is in such high need and we can't even match the two, we can't find the places where the high need is really depressing. And that is the first step here that we are trying to push for in Capital Action Day. And then it obviously sets the clear targets for school social workers, which is going to be the 1 to 250 students, and create real accountability where this public data allows us to really push for school social workers in these school districts and areas that would rather not have any school social workers be a thought even. There wouldn't be a thought of hiring a school social worker, but if we're able to collect data and prove that this is why social workers need to be in said school districts, then that is a huge leap for us as a profession and as a workforce. So data transparency wise at CAD, that is the whole point to this being one of our priorities. We really hope to have the transparency of school social workers and the transparency of these ratios be key so that we can understand where these places of need really are. And it's not like we're asking for a ton. It really does build on what already existed, and we're going to use the state's current reporting systems so it's a low burden for districts. It's not like that we are increasing a ton of work for social workers or for these districts in general. This should just be something that is already in law and just sadly isn't. And making this data public allows us to really put pressure on school districts to be able to hire for school social workers and to have a flow of funding from the state that will allow school social workers to be hired by these schools. Workforce funding reality. So the other key point that we're fighting for here at CAD is to fund the roles directly. So we need to set aside dollars from the budget to add social work positions at these schools, which is incredibly, obviously, Senator Brouk already mentioned it. This is incredibly necessary and it is key to do after 376 so that we have the funding to actually put these school social workers in these schools, right? So at CAD, we're going to be asking these legislators to really push for giving us our chunk of money, which this is sadly a future problem given that we don't know yet where these places are in New York State that need these social workers, but we understand that we need to be able to fund them to be in these schools as mental health in schools is becoming a larger and larger thing, a larger and larger problem. And so with that, I'm going to just invite you guys to Capital Action Day. I've not been able to put a lot of links in chat as I am presenting, but I will make sure to put links in chat right now. I can give you the link to Capital Action Day. This day, as a brief rundown, we go to the Capitol in Albany and we really fight for social work and the social work issues that are popping up. This is one of our 4 priorities. We've had some other priority talks, especially in the policy series, where we've discussed what we are really hoping to do at Capital Action Day. Last year we had over 100 people come to Capital Action Day where we were discussing with legislators and pushing our priorities toward them. It's incredibly helpful and it really, in my opinion, from what I've seen, uh, gets law moving. When you go with 100 people to the Capitol and show why you're upset, which there are plenty of reasons you should be, it really proves and shows to legislators that they need to focus on us, right? Because having your voice heard when you're at the Capitol is probably the best way to get your voice heard in general. So with that, I will also open it up to questions, and I'll thank you guys again for all coming tonight. I really enjoyed that from Senator Brouk, and I would love to answer any questions you all have. You can feel free to go into type your questions into chat as well. I'd love to answer anything. And I'm going to also briefly in the meantime put links into the chat to our Capital Action Day, which
I didn't tap to speak here, but
sorry, what was that?
nothing. All right. Nah, I don't know why I'm in this mode. I don't know why. I don't know what's going on.
Andrena, thank you so much. Let me day.
Mr. Curry, do you have a question or a comment?
No, I'm trying to get out of this save drive. It says I'm in save driving mode. I'm not. I don't know. You're
Okay.
not supposed to hear me. I'm trying to get out.
Okay. Well, we welcome any additional comments or questions, and we'll give it just another couple of minutes for folks. Gideon is dropping links in the chat for you. If you'd like to take a look, please do. But remember that all of these links will also be provided in the post-event email sent to all attendees of the event. And we'll give it just another couple of moments for any questions about the specific bill we're talking about tonight in regards to school social workers and the numbers at there. Yes, the recording of this will also be included in the email along with the other 2 event recordings. If you've missed the first 2 events of the series, those will also be included as well. Absolutely. Okay, we'll just give it to around 6:50. If you have any questions, feel free to unmute or drop it in the chat. We're happy to answer any questions you have around Capital Action Day, around the specific bill. Awesome. Thank you so much, Mindy.
Thank
We
you, Mindy.
appreciate that.
I really am totally willing to discuss or talk about any questions you have, but if you don't, there are no worries at all.
Absolutely. I also want everyone to know in the room that this was Gideon's first solo-led event. Shout outs to Gideon. He did a great
Sorry
job.
if I was stuttering a little bit.
No, you're fine.
Yes.
Thank you so much, Petunia. It's always nice to see you at our events. We always appreciate your presence and support. Awesome. The information for Capital Action Day, Mr. Curry, will be in that email as well. Again, as I wrote in the chat, one voice starts the choir, but it takes the choir to be heard. So we invite everyone to join us at the state capitol for Capital Action Day to support the issues that are important to you guys as social workers. All right, everyone. Petunia, please feel free to unmute.
Thank you. I do have a question. Outside of social workers, is there any other profession that rallies outside of someone's house to tell them to do their job?
I know that there are professions that go up to do it. It is very, nonetheless, I understand the question, I'll say. I do understand the question. I know nurses do it as well. There is obviously our intention is to rally to gather support, but the fact it has to be with these rallies is tough. But we will, I mean, obviously this is a part of advocacy. So yes, I do know other professions that do it, but I understand the question, if that makes sense.
Thank you.
We also have a direct advocacy that you don't, while we encourage everyone to show up to Capital Action Day, again, numbers count. We do have direct advocacy tools at the chapter, which will also be provided in the post-event email, various act nows that you can get involved through our policy team. So I'll make sure to include that information as well. If we have no other comments or questions,
We'll give it another moment or two. I really want to just shout everybody out for their presence, their attendance, their time, effort, and energy tonight, their comments. Really, really helpful to us.
Yes, thank you all for coming. Thank you.
Okay, everybody, I'm going to stop the recording. Once again, thank you all for being here. Thank you to Senator Brouk and her team. We appreciate your time and your presence. Have a great evening, everyone.